will now hand it off to Poppy and Lindsay for their presentation on the Jewish Family Services Project.
Poppy, you're on mute.
Oh, sorry, everyone. Hi, everyone. Good afternoon. Thank you for being here. I'm Wan Xiao, and I'm a data science student who just recently graduated from Syracuse University. It's an honor to join the team and participate in the project for social good. I hope you enjoy this presentation.
Good afternoon, everyone. My name is Lindsay Regan, and I am a senior studying psychology at UNF. Thank you for joining us today, and we'll be discussing identifying trends in patient scheduling for counseling services. The journey to therapy is often paved with frustration and loneliness. Between fighting for insurance to support treatment, the stigma that often rears its head, and multiple reschedules to get around work and full-time school scheduling, therapy may feel like an impossibility. It can feel like you're on the outside looking in as others live life unhindered by mental diagnosis. Thankfully, there are many organizations like Jewish Family and Community Services that exist to ensure people are not alone in their journey toward mental healing. Whether someone faces a struggle, like I mentioned, or runs into other hurdles like childcare, addiction, and the court system, there are people to guide you down the path and ensure you'll never walk alone. Under the umbrella of DuPont Counseling Group, JFCS is able to offer a multitude of services. Not only do they offer voluntary mental health counseling, but they also have the tools to help fight substance abuse and teach healthy communication and co-parenting with their Circle of Security parenting classes.
Now, let's talk about the challenges that JFCS is currently facing with. The primary challenge is the client's no-show rate, because the absence of clients will definitely influence the billable hours for their primary therapist and also the effectiveness of the patient scheduling process. As for the problem of billing method, because JFCS wants to provide more access to the public, JFCS works with various funding programs to support their clients. Those different programs require different types of work procedures that can cause or may cause barriers to access to consulting services. Next, I'd like to talk about the project focus. And for the client's no-show rates, we have collaborated with JFCS and completed a series of tasks of text mining and visualization. As for the problem of scheduling process and the billing method, we generated a tailored scheduling process after several rounds of communication with JFCS. At last, we will provide several recommendation tips for potential improvement and a project report with in-depth research. Now let's move on to the next section and talk about the identified data set we received from JFCS. The first one is the ECR records that is from a local electronic client's recording system, which owned by the JFCS to track the services data and the client's information. Among the 30 files we received, we filtered and extracted several indicators, including the age, the primary therapist, the length of the services, and the discharge reasons. The second one is related to the therapist's caseload and the scheduling statistics. And the last one, which is the Google Calendar, is the primary data source we have been using for no-show analysis and visualization. We've received 9 files from the JFCS, and each one represents each therapist who has worked in JFCS. Those files were all stored in ICS tab, holding the records of appointment scheduling data, such as the date and the meeting title. Since those data sets share limited connectivity, the only indicator could be used for the data connection is the therapist's name. For the next section, I want to start with the problem that we found from the project. The transformation of Google Calendar could be difficult because some common data problem might occur. One data problem we find is word variation regarding no-show. The preference of recording no-show appointment varies among those 9 therapists, as some of them prefer to use no showing, not showing, while some of them prefer to use not engaging and not attended. Now let's look at the process. Data extraction is the first step, which transfer Google Calendar from unstructured data to structured data. The next step is the data merging, which combines individual files into one single data set. The following one is the text mining. In this step, we filter out unnecessary elements and generate our own new elements that originated from the indicators. And for the problem of word variation we just mentioned, we use the techniques of keyword extraction and coreference resolution to solve this problem. And for the last step is Tableau dashboard representation, which visualize the data among the factors and enable the stakeholders to understand their data more clearly. Because one of our targets is to analyze the patient's no-show rates, we need to focus on the appointment that ended with no-show and cancellation. The first plot, as you can see from here, is a tree map showing the distribution of no-show and cancellation by different programs. It highlights that the intake section took up over half of the total number. And because of this reason, there's no room left for the rest of the program. So after filtering out the intake section, we get a slightly different treatment map, tree map that, as you can see, the treatment, BBA, COS, again, are the top 3 programs. But treatment has a relatively bigger size than the rest of them. So this may means that the JFCS may need to pay attention to not only the intake section, but also the treatment session. Next, let's see what's the distribution of the no-show and the cancellation by weekday and time frame. It's surprisingly to see that Tuesday and Thursday are the 2 days that are consistently on the top 3, while Monday is the day that has a relatively lower cancellation rates and no-show rate. If we group the data by time frame, we could find that most of the no-show cancellation appointment happened in the section of afternoon and early morning. Now let's look at the analysis of ECR dataset. Patients has been identified as discharged once they have been transferred from being a patient to not being a patient. To provide better services, JFCS keeps tracking the records of discharge reasons. We specifically focusing on the unsuccessful discharge reason, and as you can see from this plot, most of the unsuccessful discharge reason were unspecified, which could be an incantation of JSCS to add more discharge reason in the future. And if we exclude this section from this plot, we can see that the top 3 reasons are unable to connect clients does not keep appointment, and client request to terminate, which also could be another incantation of JFCS showing a little or potential issue of communication barriers. Furthermore, the third one, which is the clients does not keep appointment, is as same as the client's no-show rates and cancellation, which could be linked back to the no-show analysis.
One of the areas we were able to assist JFCS was by documenting the steps of their patient scheduling process. After talking to them over the course of 2 meetings, we were able to create a workflow that included all steps from receiving the referral, from scheduling, and to scheduling the actual appointment, then documenting patient attendance. When we then reviewed it with the JFCS operational team for correctness, implemented any necessary changes, and were able to recommend areas where they could tweak the data collection process for more consistency. Here is a segment from the scheduling workflow we created focusing on patient attendance. It demonstrates our recommendation for use of key phrases at critical decision points in the decision-making process. The development of the workflow, along with the analysis of the data, allowed us to make some recommendations. At the end of the project, we arrived at 4 major recommendations for JFCS. First, we recommend that they create a system of patient ID numbers. While previously they'd use ECR to search client names, ID numbers will cut down on duplicate records and allow them to save time and thereby assist patients faster. Our second recommendation is to use Google Forms for all data collection needs. Since Google Forms are a free resource, it will allow them to build a database outside of ECR while also allowing them to further speed up the path to patient care due to the ease of the program's search engine. Our third recommendation is the creation of a Google form focused on collecting no-show particulars. By tracking the particulars of patients with the tendency to no-show, JFCS will be able to recognize commonalities between no-show patients and use that data to improve the no-show rate. Finally, we recommend that key phrases such as no-show are added to the calendar entry when a patient does not attend their appointment. Previously, certain therapists would use the phrase no-show, but would delete all client information. This makes it difficult to track which patients no-show and which patients attend their appointments. By making sure to only add a key phrase such as no-show, they're able to track which patients have the tendency to no-show over their calendar. Next slide. Oh wait, this is my next slide, apologies. It was an honor to work with the Jewish Family and Community Services and see the contribution they made to Jacksonville's social good.